If you have a leaky mitral valve and you're trying to avoid open heart surgery, luckily we have a procedure now that we can do called the MitraClip. This is for people with moderate to severe mitral regurgitation. This basically means you have a leaky mitral valve and you don't qualify for open heart surgery, or the open heart surgery would be too risky, and a number of other variables. But sometimes you would qualify for this thing called the MitraClip. And talk to your provider, talk to your physician or cardiologist at Toledo Cardiology, or one of our nurse practitioners, whoever you see. But the idea is that without cracking your chest open, without slicing open through your breastbone and having to do open heart surgery, we go in with a catheter, sort of like a cardiac catheterization, and I'll put an animation or a video up here. We go in with a catheter like a cardiac catheterization, and we go into that area where the valve is, and we have this little thing called a clip. There's two leaflets of the valve. They open and close. They're staying open. The valve is leaking back and forth. It can make you short of breath. It can make you fatigued. It can make you tired. We go in and we clip those two leaflets together. They're supposed to be opening and closing. They're staying open. You go in and clip them together, and then that eliminates the leakiness. Now, this has incredible success rates, and our patients are doing fantastic on this. Instead of having to do open heart surgery, now you have this second option or other alternative option that does not require open heart surgery, and you can have your valve repaired, or at least have the regurgitation significantly reduced by a procedure that does not require you to stay in the hospital for 3 to 5 days, sometimes even longer. Having the open chest, the sawing down your chest and stitching everything back up. And even though they can do it minimally invasive nowadays, a lot of times the recovery is still quite difficult. So with this procedure, we do it through a couple of catheters through your leg. We go up into your heart. We take pictures. We have imaging. We grab the two leaflets of the valve and we hold it together, and the valve basically stops leaking. Now, it still leaks a little, but it's just not as severe as it used to be. If you feel like you qualify for this, or you want to look into it, or this is something that interests you, I highly recommend you bring that up to one of our cardiologists at Toledo Cardiology, or one of the nurse practitioners, and we will get you on the right track. We'll have you meet with the structural team. This is called structural heart disease. You can meet with the structural heart disease team, and we can decide if this is the correct option for you.